My name is Linda Estrada, and I have been with ACPS and Dr. Morales for 8 years now. My primary duty at ACPS is patient coordinator to Dr. Morales. So when the patients come in, they'll meet myself first. I go over their medical history, their prime concerns for having surgery, and then Dr. Miles will come in and examine them. And then they'll end with me as far as like quoting and scheduling and things of that nature. So in our practice, we include everything that the patient needs to recover properly. And we feel that it's a huge advantage because patients are not going out after surgery trying to obtain supplies and things that they need. So everything is given to them prior to the surgery so they can get ready for this huge event in their life. Our mission here with Dr. Morales is to provide the best patient care safely.
And what exactly does that entail?
That entails being a legion. I can never say that.
Liaison. We had
that's
the same word from last time. I remember that.
I know, but that's like the best word, but I can't say it. Liaison. I am the liaison.
I serve as the liaison.
I serve as a liaison how do I say that? Between Dr. Morales and the patients, right?
I serve as the liaison between Dr. Morales and his patients.
I serve as the liaison. Can't say it. Say it again.
Liaison.
I serve as the liaison.
Liaison.
I'm trying too hard.
I serve as the liaison between Dr. Morales and his clients. So when a patient comes in, who do they see first, and what do you get to explain to them? Okay, that was good. You said how many years you've worked with Dr. Morales?
I did, yeah.
Okay. I should have asked him again what questions he wanted to go over.
He said that, and then he said...
What's the benefit with working in an office with other doctors for ACPS?
So it's a great benefit because...
I'll repeat the question, though.
Okay.
Being a part of ACPS.
So what's the question again? Being a part of ACPS?
What's the benefit of, instead of him just being off on his own,
right.
What's the benefit of being part of ACPS?
Yeah. So you want me to ask it? Say the benefit...
The benefit of being in
The benefit of being in such an amazing practice like ACPS is that we have other doctors here as well. I don't know.
Is there a benefit?
I mean, well, there is, but I mean, not that people need to know. I mean, financially, there's a huge benefit to him. But so I don't want to hear that. I was going to say, like, the benefit is that there's other doctors here and they all specialize in different things.
Okay.
Does that work?
That'll work.
So one of the benefits of being in such an amazing practice like ACPS is that we have so many great doctors that work together.
Just start and say that work together, that each specialize in something different.
That work together and each specialize in something different.
What is the what's the thought process as far as customer service goes with Dr. Morales?
So Dr. Morales offers the best customer service.
Let's start it over.
Dr. Morales offers the best concierge service.
Concierge service, right?
So Dr. Morales, I feel, offers the best concierge service to our patients.
What are some of the things that Dr. Morales does through his concierge service that you won't really see other places? Let's talk about the care package and the things that the people receive before they have their surgery. I know they get vitamins, they get all the bandages and all that type of stuff. Talk about covering all the bases there.
So we cover all the bases in our practice as far as recovery kits. No. So in our pricing, everything is included. No? No. In our practice, we include, no.
In our practice, we include everything you need to recover properly.
Right. In their life or lives?
In their life.
Okay.
Yeah. Talk about the importance of a board-certified plastic surgeon compared to not board-certified.
It's so important for patients to find a board-certified doctor. But why, though? Some of those...
So real quick, before we even go into it, what's better between a board-certified? They have better training, obviously. They have more.
They have more training.
They're more. The actual board of plastic surgery has put their stamp of approval on that person, correct?
Right. Yeah.
Okay.
Okay. So the benefit of finding a board certified plastic surgeon is that they have been certified. No, I don't like that.
The benefit of Dr. Morales is a board certified plastic surgeon? Go ahead and say that. We'll stop.
Say that again.
Dr. Morales is a board certified plastic surgeon.
Dr. Morales is a board certified plastic surgeon.
And that is important.
And that is important.
I don't know how much.
It's silly. Wait.
And that's important because you know he's been trained properly and he has the stamp of approval by the board of plastic surgery.
Okay. So where do you want me to start? So let's start.
And that is important because you know that he has been trained properly and has the stamp of approval from the board of plastic surgery.
So that is important because you know that he has been properly trained and also has the stamp of approval from the board of plastic surgeons.
Just repeat this. And that means he has the stamp of approval from the board of plastic surgery.
And that means that he has the stamp of approval from the board of plastic surgery.
How much care do you see Dr. Morales putting in his work?
Dr. Morales cares a lot about his work, his patients, and also his staff.
In what ways does he show that to you?
Dr. Morales...
His staff, how does he show that he really cares about his staff?
Dr. Morales really shows that he cares for his staff, basically by always being there for us as far as, you know, if basically anything we need, he's, no. How does he care? He cares a lot. Dr. Morales cares a lot about his staff. No. Oh, jeez. Like he's so patient. He's so patient. He's so compassionate. You know that he's only yelled at me one time in 7 years?
Here, forget trying to repeat what I say. Just talk to me.
Yeah, so
tell me something like personal that he's ever done that would show you how much he cares for you.
Oh, I mean, there's a list of things that he has done for me as far as caring for me. You know, he's always encouraging us to learn more. I mean, it's just so many things that he has really done for his staff.
Would you say he's more of is he more lead by example? Is he more of a, I'm just going to tell you, y'all go do your thing?
He's definitely a lead by example. You know, he's always striving to do his best in everything that he does. And so for me personally, that always makes me want to do the best, you know, even though he's okay when you make mistakes, I still want to not make mistakes and be the best because, you know, that's what he shows us.
How nice is it to work here with Dr. Morales, knowing that he's really laid back and he's easy to converse with, he's easy to get along with, and he almost seems like he's more of one of y'all's like friends than your boss.
Absolutely. It's a blessing to work for him in ACPS, as far as, having a family-oriented place where you work.
What are some of the things that you guys do as an office to kind of build your, camaraderie, your, what do you call it, like team building? Mm-hmm. Are there any stuff that y'all do to do like team building or?
So we do quite a bit for team building. Dr. Morales holds boot camps once a month with his wife, Corey. And so for us, that's team building because we get to go there, we get to learn, and we also get to spend time with each other as far as like everyone that works here. And everyone is invited that works at ACPS.
How well does Dr. Morales handle stress?
He handles stress very well, I would say. You can never tell when he's very stressed out or frustrated. I mean, he handles it pretty well.
Do you feel like that rubs off on everybody else that works here?
Absolutely rubs off because you see him with, stressful situations and he's very calm. And so for me, it makes me think like it's not that bad. There's solutions to these issues that we have.
What would you say the ultimate goal is? What's your mission statement as far as Dr. Morales Plastic Surgery is concerned?
Top patient care, safely, yeah.
Say, our mission here at Dr. Morales Plastic Surgery is. What kind of measures and what kind of research and studying does Dr. Morales do to make sure that he is as safe as possible with his patients?
Well, Dr. Morales stays very up to date on the medical procedures out, basically on how do I say that?
How often does he study, you think?
I don't know, Jason.
Oh, you know.
I mean, he's always studying. He's always, looking at new things and, always up to date on I wonder what that's called.
Yeah, about this. How important is it for your plastic surgeon to be up to date with all this stuff coming out?
It is very important for your plastic surgeon to be very updated and stay up to date basically with everything going on in the industry. The industry changes by the second. So, there's new procedures coming out, there's new techniques, and so Dr. Morales stays very up to date on those techniques.
What would you say are the top few things that someone should look for when choosing a plastic surgeon?
When choosing a plastic surgeon, the important things are that he's board certified. You want to make sure that you're seeing before and afters, and also their reviews are very important.
Tell me about the reviews. What would someone see if they were to go read a bunch of reviews about Dr. Morales?
Dr. Morales has very good reviews because we make sure that our patients are happy. We're communicating constantly with them to make sure that we know what they're expecting. So expectation is a really big deal when we're talking about plastic surgery.
When someone's scared or nervous, what are the things that you tell them to kind of ease their mind about getting any kind of procedure done?
So patients are always going to be very scared and nervous of having a procedure, which is reasonable.
I was gonna like that.
Which is reasonable when you're undergoing these type of surgeries. So one of the things, we want to ensure them is that they're in the best hands possible, not only with Dr. Morales doing the surgery, but also at our surgery center with our anesthesiologists and the surgical crew that we have, which have been with us for a very long time.
You mentioned the surgery center. That's an important aspect about.
Oh, sorry, don't look it up.
No, you're good. But let me ask you something real quick. So we're talking. What were the bullet points you said? We've talked about a ton of shit.
So we talked about, so we did the, how long
you been in practice?
I did that.
Oh, wait, how long you've been in plastic surgery?
Yeah.
How how long you've been with me.
Mhm. We did that.
How you work with me as far as what you do, your philosophy. We were up to the goal of how to take care of patients, blah blah blah.
Yeah, so we hit all those points. Yeah.
You haven't said how long you've been in plastic surgery. Is that different than how long you've been
I
here?
think I said I've been with Dr. Morales. I think I said I've been with him for 7 years, and in the industry for 15.
Yeah.
I think I
Yeah.
said that
You did?
in the beginning. Yeah.
Okay.
You
I thought
ready?
you were with the patient this whole time. I've been waiting for you.
I'm sorry.
It's okay.
I'm trying to get it done. I'm sweating.
She's done. Next.
Yeah, I think we did. I think we hit
Oh,
all
thank
that,
you.
all that plus some.
Yay! This was, I think.